Hi everyone, welcome back to the Australian Rotary Health podcast called The Research Behind Lift the Lid. I'm Jessica Cooper, and joining us today on episode 37 is Dr. Marlee Bower from the University of Sydney. Marlee received an Australian Rotary Health Ian Scott PhD scholarship from 2014 to 2016 for her project called The Experience of Loneliness in the Australian Homeless Population, which she undertook at Western Sydney University. Marlee is now a postdoctoral research fellow at the Matilda Centre for Research in Mental Health and Substance Use. Her research interests include broader social determinants of mental health, particularly understanding loneliness and isolation amongst marginalised individuals and how this relates to the built environment. So welcome to the podcast today, Marlee. Thanks for joining me. How's everything been going for you?
Good, yeah. I mean, it's been a year, but no, it's nice to be here today on this podcast. Looking forward to it.
Yeah, thanks again for joining me. And I know a bit of time has passed now since you completed your PhD. So I guess I think our audience would be interested to know, what have you been up to since then?
Yeah, so a few different things. So when I was finishing my PhD, I got a job working at the New South Wales Inspector of Custodial Services as a research officer, which was really interesting, and used a lot of the skills that I learned in my PhD. So I had to work inspecting custodials, correctional centres in New South Wales, all over New South Wales, and use skills that I learned in my PhD, like stakeholder engagement with different services and corrective services, the role of services in supporting marginalised populations and policy, and I really enjoyed that job. I then worked at Family and Community Services, which is now Department of Community and Justice, doing their homelessness strategy stuff there too, which was, also seemed to flow from my PhD. And now I'm working as a research fellow at the Matilda Centre, and working across a number of different projects in the criminal justice space, so kind of in that space, but also in mental health policy in Australia more broadly, and in mental health and substance use post-COVID.
Yeah, well, it sounds like you've been very busy since then, and it's good to see that it's kind of flowed on like really well from your PhD, like working in that same area. So yeah, that's really great to hear. I guess rewinding back a little bit now to when you were first deciding on a topic for your PhD, was homelessness something that you'd always been interested in exploring?
Not particularly. When I first finished my psychology honours at Sydney Uni, I wasn't really sure what I wanted to do or what to do with my psych work taking forward. I'd always been interested in social disadvantage and the impact it can have on mental health, and had worked with Vinnies before that. But when I saw a research assistant job going at Western Sydney Uni with Dr. Elizabeth Conroy, that was conducting an evaluation of a Housing First program with 75 chronically homeless men in Western Sydney, it felt like a really good fit, and I was really interested. In interviewing with men, I became really interested in loneliness and how it was experienced by that group, what loneliness was for them, why they're experiencing it, and what impact it had on their capacity to maintain their tenancies over time. So Elizabeth then became my PhD supervisor, and that was that really.
Oh, cool. Yeah. Well, it sounds really interesting. Could you maybe talk us through what your PhD involved, like maybe some of the aims or research questions that you were looking at and how you went about answering those?
Sure. So my PhD aimed to answer a few research questions. Firstly, I wanted to know what loneliness was for people experiencing homelessness, how they understand it, and I answered that question with qualitative interviews with 16 people who are really diverse, who are either currently or formerly homeless, living in the broader Sydney region. I also wanted to know how many people who are experiencing homelessness also experience loneliness, and what factors are associated with whether or not someone is likely to feel lonely. And I answered that question using kind of a survey, so a longish survey, which I designed based on the findings I had from the interviews. And the surveys were quite long. They could take a couple of hours because it was a face-to-face kind of framework and quite involved questioning. So I ended up doing about 126 of those over time. So it took quite a while, but it was really worthwhile.
Yeah, I'm sure you would have gotten some really interesting information out of those interviews as well. How did that sort of inform your results from the study?
Yeah, I think it was really essential to have that kind of experience of talking with people one-on-one. You can do so many things at a distance by sending off a survey and getting people to complete it online, but that's not really always possible with a population like people experiencing homelessness that tend to have such high rates of cognitive impairment and things like that. But as a result of having that kind of one-to-one contact with so many people, I feel like I got a really good understanding of what some of the main issues were and how they could be best addressed. So I can talk about some of the findings that I thought were particularly useful or interesting, if that's something you're interested in hearing.
Great to hear.
Okay, well, one thing that was somewhat surprising for me, but I suppose makes sense, is that people tended to have actually a lot of friends around them, a lot of connections that were helping them while they were homeless. And these relationships were really beneficial for their survival, sharing resources, sharing places to stay, things like that. But actually, these relationships can marginalize people long term and often aren't really who they want to be spending time with, depending on who they see themselves or how they see themselves in the world, both prior to homelessness but also after. And I learned that their loneliness can really only be addressed through meaningful relationships with a person or a social group that they really value. So having substitute relationships with service providers or pets or even, friends will not always compensate for those that they really want.
Yeah, that's very interesting. Was there anything else that you sort of found from this research as well?
Yeah, I think it was interesting for me because a lot of the kind of best practice approaches in homelessness are about housing and tenancy support, post-housing. And that is really seen as a gold standard, but is actually quite far away from what people in services really have the funding and capacity to do. But my research really showed that you do have to go kind of beyond that. It can't just be that you're offering kind of a one-size-fits-all tenancy support solution, because what you need to be asking, and it's not rocket science, and it sounds probably overly simple, but it kind of gets the point. You have to ask people, who are you and who do you want to be? And then kind of help them to get there. And if you don't do that, you risk someone leaving tenancy early and going back to old friends and habits on the street. Now, people need a lot of support through the transition of exiting homelessness. Putting someone in a house doesn't necessarily solve things because it often doesn't last long term. You need to make sure that you work with them to figure out a way that they can thrive in their new community and integrate well.
Yeah, well, yeah, it definitely sounds like you have found, a few, key findings there that could potentially have some impacts for real homeless people. I guess, what kind of impacts do you think that this might have in terms of mental health?
Well, I think that loneliness itself, it's becoming more popular to talk about in the public sphere because it is linked with so many other mental disorders, but has a massive kind of costs to society. So they found that the mortality rate associated with loneliness is on par with other kind of non-communicable practices like smoking or alcoholism. It's a very dangerous experience. So if we find ways that people can and people who are experiencing homelessness tend to have much worse mental health than the mainstream population. And that's the result of the real struggle and intensity of what it means to be homeless and the day-to-day kind of stress that you go under, but also people who experience homelessness have like a higher likelihood of having experienced a trauma history and incarceration, a lot of things that can be, have negative impacts on your mental health. So when we do look at things like loneliness and we look at how we can change things or alter it over time, you do expect to see commensurate improvements in people's broader mental health. And I think that loneliness for people experiencing homelessness can be a real key to unlock what could be a more fulfilling and meaningful life for people post-homelessness.
Yeah, absolutely. Yeah, well, I guess, as you said, loneliness, it really seems to be a key here for helping these people, and hopefully more kind of flows on from that. I guess, in terms of research, did you have any other plans to use this research data to expand on what you know already, or, kind of work on that policy level?
Yeah, I mean, I've been slowly going through and publishing things based on my findings. So I suppose in that way, the data is continually being used. But I also take almost any opportunity I'm given to share my findings with services to ensure that the research goes straight to the people that can use it, to advocate for funding and things like that. And I intend to keep on doing this into the future. But in another way, I'm now leading a study called the Alone Together study, which is looking at the impact of COVID-19 on about 2,000 Australians' mental health and substance use over 2 years. And I've been able to include lots of questions around loneliness and social networks because I know from my PhD findings that's a really important area for people, and an area, as I said, like a key that unlocks a lot of other issues with mental health, or other causes of mental health problems. But I'm also taking a housing lens, so asking questions to people about their housing history and what housing they're in, and included around 45 people experiencing homelessness in that study to ensure their voices are also heard in these kind of collective understandings of the impact of COVID. So although it's not exactly the same data, it is that extension of the same kind of idea to take it forward and go, hey, okay, so this is not a fully homeless sample, but how do people experiencing homelessness relate to other populations in Australia? Are they dealing with something as big as COVID?
Yeah, that would be definitely very interesting and very topical at the moment. So it'd be great to hear about those findings as well when they eventually come out. Yeah,
for sure. I'll definitely keep in touch.
Yeah. So I guess, this scholarship was awarded to you at the start of your research career. I guess what kind of impact did this have for you as a researcher?
Yeah, I mean, I'm really very, very thankful and grateful to Rotary Health for my scholarship. It provided me with the means to start my own project and career instead of working on other people's projects. And I was able to really pour all my passion and commitment into that work. And I think that Rotary was really special in that way because it, unlike a lot of the other funding bodies, I suppose, gave a chance to a project that isn't like strictly mental health medical. Like loneliness is a mental health issue, but it's not, a DSM diagnosis as, with depression or anxiety. So I suppose they put their faith in me, and that was really special, and I was grateful for that. But also, Rotary, of course, gave me access to lots of other incredible experiences, like sitting in on the grant review process for Rotary grants 1 year and media training, as well as kind of countless opportunities to share my research findings at Rotary clubs across South Wales. So I really enjoyed that process, and I think I owe Rotary a lot, and it was a special experience I'm not sure I would have had with any other scholarship provider. So thank you to all of you.
Well, I'm sure the Rotarians really enjoyed hearing your presentations about your research as well, like when you probably went to club meetings to meet some of them. Yeah. Yeah,
lots of
yeah, I'm sure they would have really enjoyed that. And it's really great to be able to talk about this research today on this podcast as well. I guess, was there anything else that you'd like to let our Rotary audience know today before we wrap up?
I suppose I'd like to say that I think that the work that you're doing supporting mental health research is so important in an Australian context. Like, we know that mental health issues like anxiety, depression, or substance use are some of the biggest burdens of disease in Australia, and they're really comparable to things like cancer. But yet we don't have the same funding into research that's proportionate with that risk. So we know that research in mental health saves lives, and we need to keep it going to ensure that people in Australia have as good a lives as they can. Because we all know we're worth it. So thank you again for your time today, and thank you so much for listening to me and listening to my talk about my research.
Yeah, well, thank you again for sharing. And as you said, it is so important, and it is so underfunded, that area of research. So hopefully, we can keep doing this work, and hopefully we have researchers like you who are continuing this work as well. So that's really great.
We need to grow.
Yeah. Well, thanks so much again, Marlee.
No worries. Thank you, Jess.
That was the 37th episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health, and how they are helping us on our mission to lift the lid on mental illness. If you can, please support important mental health research like Marlee's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.